All right, today we're jumping into a really cool medical story. It's one of those classic tales of what we think we know versus what the data actually tells us. And it all revolves around a pretty common surgery. So yeah, let's dive right in.
So here's the big question, right? It's something you hear all the time. If you're a patient with diabetes, is surgery just riskier? I mean, it kind of makes sense on the surface, right? It feels like a safe assumption to make. But is it always true?
Okay, to really get what's going on here, we first have to talk about the conventional wisdom. The belief that kind of underpins this entire conversation.
Yep. For ages, the general thinking has been super clear. Having diabetes can mess with your body's ability to heal. It can affect circulation, your immune response, all stuff that could, slow down recovery or cause problems after surgery. And look, that's a totally reasonable and very common concern.
Now, the specific surgery we're zeroing in on deals with something called insertional Achilles tendinopathy. It sounds complicated, but really it's just a super painful issue right where that huge tendon at the back of your ankle hooks onto your heel bone. Sometimes you even get this bony bump that makes everything hurt even more.
Okay, so this is where the two ideas, diabetes and this tendon problem, collide. See, there's this biological thing that happens. It's called non-enzymatic glycosylation, which is a fancy way of saying that too much sugar in your blood can make your tendons stiff and not as stretchy. So the fear was, if you're a patient with diabetes and you operate on that tendon, well, you might be in for a much tougher recovery.
But here's the thing, a fear, even when it sounds totally logical and scientific, isn't the same as a fact. And that is exactly why we have research, to step in and see what's really going on.
And this is what I love about science. Instead of just shrugging and accepting what everyone's always said, some researchers decided to ask a simple question. Okay, but what does the data say? They decided to go back and look at the real-world results from this exact surgery.
Their method was super simple and smart. It's called a retrospective study, which just means they looked backward at patient records. They grabbed the files for everyone who had this surgery from 2017 to 2022, sorted them into two piles, one for patients with diabetes, one for patients without, and then they just compared them.
So in the first group, the one they were really curious about, they found 18 patients. These were the folks who had the Achilles surgery and also had diabetes.
And for the comparison group, they had 132 patients. Same surgery, just no diabetes. So, boom, the stage was set. You've got your two groups, now you can really see what's what.
All right, so the groups are set, the data's all there, time for the big reveal. And honestly, what they found was pretty surprising. Definitely not what most people would have guessed.
So was the old assumption right? Did the patients with diabetes actually do worse? More problems, more hospital visits? Did the surgery just not work as well for them?
Okay, check this out. It's kind of wild. When they looked at who had to be readmitted to the hospital, no difference. When they looked at who needed a second follow-up surgery, no difference. Tendon re-tears? Nope, no difference there either. Even when they looked at how patients felt they were doing, still no difference. Across the board on every single important measure, there was just no real statistical difference between the two groups. None. And the researchers themselves were super direct about it in the paper. They basically said, look, we didn't see higher rates of anything bad. Not readmissions, not re-tears, nothing in the patients with diabetes. The data just flat out didn't back up the fear.
So yeah, a pretty surprising result. But it's really, really important we understand what this actually means and what it doesn't mean, because the big picture here goes way beyond just this one type of surgery.
Here are the key things to walk away with. First, for this specific Achilles surgery, the outcomes for patients with and without diabetes looked pretty much the same. This really challenges that blanket idea that diabetes always means higher risk. But, and this is a huge but, we're talking about a single study that looked backwards at a fairly small group of people. So think of this as a really interesting clue, not the final word.
And hey, the researchers totally get this. They're the first to point out the study's limits. They even say in their paper that what we really need are bigger studies that follow people forward in time. And that right there is what good science is all about. You say what you found, but you're also honest about what you don't know yet.
And that's really the heart of it, isn't it? Our understanding of medicine isn't set in stone. It's always changing, always evolving. A study like this doesn't come along and just rewrite all the rules overnight. What it does is it chips away at an old assumption. It puts a little crack in it and shines a light, basically telling other scientists, hey, you should probably look over here. There's something interesting going on.
Which kind of leaves us with this one big, powerful question, right? When you see a long-held belief like this get challenged by actual data, it can't help but make you wonder what other facts that we all just accept are just sitting there, waiting for someone to finally ask, yeah, but did anyone actually check the data? Really makes you think. Thanks for tuning in.